We're going to have discussion about cytokines. Within these days, within these 2 days, I could realize that we all would like to come to a common cause of the diseases and to see whether our body can do reorganize itself or not. Because diseases are disorganization, or better to say dysregulation of our balanced system. It doesn't work? Tomorrow it will work. Let's see. You know, inflammation. We all know inflammation. When something injurious to our body occurs, the body goes through inflammation. Our body shows its reaction to the injurious insults with edema, with redness. And this inflammation, everybody, when see the inflamed tissue of the body, scared. But inflammation is not a bad thing. It may preserve, it may repair the body, but how much the inflammation is if the inflammation is higher than can be tolerated, the dysregulation occurs within the balanced system of our body. For example, the most dysregulated inflammation is sepsis. Sepsis is a very harmful sort of inflammation that occurs in ICUs. But what occurs within the inflammation? You know, we all talk about remissions, we all talk about balance formation, reformation, but the thing that our cells can cross-talk with each other. We do not have liver here alone, we do not have lung here alone, we do not have brain here alone, but they cross-talk with each other. This crosstalk is very important. For example, when you have, thank you very much. Okay. And talk about this. Inflammation can manage all parts of the body, all the tasks our body can do. And the dysregulation that occurs in inflammation, if it occurs, it may result in diseases in any part of the body, like cancer, like cardiovascular diseases, and also in neuropsychiatric disorders, neurodegenerative mood and anxiety. And the thing that is important is that when an inflammation occurs in our body, our brain knows the patient feels tired, sleepy, would like to go in solitary place for the reason that he or she would like to repair her body, the dysregulated part of the body. And also, cognitive and emotional symptoms occur. For example, depressed mood, feeling of self-worth, concentration problems, suicidal acts. We have, in any inflammation occurs in our body, we have neuroinflammation too. What is the messenger of neuroinflammation? The messenger is cytokines. Cytokines are not small, not big, moderate size proteins, but small glycoproteins. Some of them are not just proteins, some of them are glycoproteins. Means protein bind to a monosaccharide or saccharide. This is glycoprotein. And this cytokine produces sickness behavior, delirium, and on the top of the inflammation, septic encephalopathy. I do not want to go to the details of the molecules because we have non-homogeneous group here, some of them psychiatrists, some of them psychologists, some of them physiotherapists. You are not a homogeneous medical professions. And for this reason, we're not going to go to the details because it would be boring for you. Okay, what are cytokines? I told you, they are not small, moderate size proteins, but small glycoproteins. What do? They contribute to many intracellular pathways. It doesn't mean that if the inflamed tissue is in my arm, cytokines are just here. No, it's distributed all over the body. And once we thought brain as an immunological privileged system, it means that once the scientists thought that our brain was a separate or segregated tissue, that immunologic system cannot go or penetrate into it. But it is not the same. Dr. Kipnis from Virginia, who is neuroimmunologist, says that we have T lymphocytes or some cells of our immune system called T lymphocytes in our brain. And they contribute to our memory. Without them, our memory cannot do its job well. In health, cytokines make brain alert of eruption of something injurious and contribute to cognition, memory modulation, among them temperature regulation, appetite, drinking, and you can see how many vast areas cytokines contribute to. 3 categories of cytokines. I put this slide because the next slide can go back to it. But pro-inflammatory, it means that some cytokines induces inflammation. Anti-inflammatory, some cytokines are against inflammation and ameliorate inflammation. And some cytokines go to do hematopoiesis, means producing blood cells. Okay. We have one of the cytokines that we can nominate here is interferon alpha. It has been used to treat hepatitis C and cancer and multiple sclerosis. But whenever the patient is prescribed interferon alpha, depression occurs. Depression occurs. Why? Because this cytokine, although it is administered peripherally through the blood, it goes to the brain, induce brain cells called microglia to produce other cytokines within the brain. And these cytokines make the patient be depressed. Some subpopulation of major depression patients have markers of inflammation. They have interleukin-6 and some other cytokines in their CSF, cerebrospinal fluid, the fluid that we extract through needle we put in the vertebral column, CSF, the fluid that is can be found within our brain. So in CSF, inflammatory markers are high in some population of depressed patients in major depression. And in their blood, we can find acute phase reactants. It means that inflammation, although they are in major depression, inflammation occurs in all over the body. And in PTSD, you can find nuclear factor kappa B. Nuclear factor kappa B is a molecule that is produced by cytokines, pro-inflammatory cytokines, to go to the nucleus of these cells. And this factor induces transcription or production of many molecules from the DNA. Major of these molecules that are produced by nuclear factor are inflammatory molecules, contribute to inflammation. So in obsessive-compulsive disorder, anxiety-related personality, we have also cytokines higher than a normal person. You know, in some studies, it was found that anti-cytokines drugs can ameliorate depressive symptoms. And even when you use aspirin, it can have antidepressant efficacy. Simple aspirin. Cytokines regulate production of other cytokines, alter blood-brain barrier. What is blood-brain barrier? You know, our nervous system and the brain and the spinal cord should be segregated from other parts of the body because we have many toxins when you eat something. You may have some toxins, neurotoxins, come to our intestinal system and come to the blood. It should not reach to the brain. For this reason, there is a hindrance, an obstacle around the brain tissue, around the nervous system that hinders penetrating of toxins or the changes in our electrolytes do harm to the nervous system. So we have blood-brain barrier. This barrier prevents neurotoxins or alterations harm to the brain. But cytokines can pass this blood-brain barrier. Many facilities help cytokines to pass this blood-brain barrier. Cytokines influence neurotransmitter metabolism. They can reduce dopamine. They can reduce acetylcholine. They can increase glutamate. I will talk about this if there is any time. And the thing that manipulation of cytokines in the periphery may induce their changes in the brain too. They can reach to the brain, or they can induce endothelial cells, the cells that cover the inner side of the blood vessel, go to the brain to produce other cytokines. And whenever a protein or messenger would like to exert its effect to a part of our body or a cell, it should have a receptor. Receptors of cytokines can be found in hippocampus. Where is hippocampus in the brain? Our psychologists know, and I know that psychiatrists know too. Hippocampus is a part of the brain that contributes to the memory. Some part of memory. Amygdala, other parts that can contribute to the memory. And we have here interleukin-1 beta. Do not look at it as a distinct molecule, but think of it as a cytokine. It can, hippocampal dependent plasticity and learning depends on the cytokine. It was a bad molecule. It is the prototype of pro-inflammatory cytokines, but it contributes to plasticity and learning. Yes, cytokines can do good jobs in our brain. They can contribute to the memory, but if their concentration goes higher than a level, they may exert inflammatory reactions or responses within our brain and do harm to our brain. Chronic overexpression of interleukin-1 in the hippocampus impairs spatial memory, context-sphere conditioning. Who knows context-sphere conditioning? Okay. The fear conditioning make an animal, preferably a mice, to be conditioned in a fearful context. When you put a mouse over a metal plate and give the mouse a shocking, electrical shocking, and then the electric shock is stopped, and then the mice goes to its other chamber. Once again, the mice is come back to the metal plate, although there's not an electrical shock, but the mouse fears. This is the contextual fear, and it goes to the memory of the mice. Interleukin-1 beta can impair conditioning, context-sphere conditioning. The mice cannot remember it, cannot recall it, and impairs induction and maintenance of long-term potentiation. Long-term potentiation is a phenomenon needed for memory consolidation. Okay, another cytokine which is very, very important in our body, tumor necrotizing factor, it impairs passive avoidance memory, synaptic plasticity. Could you give me a definition of plasticity? Synaptic plasticity.
Ability to adapt either sort of functionally or structurally.
You know, memory, once upon a time, go to the story. Once upon a time, it was thought that memory is circuits of neurotransmitters and electrical waves go through our brain. Nowadays, it is not. It depends on how many synapses can be produced between two sequential neurons. And plasticity means how the synapses can move. Could you recall yesterday Dr. Sedik lecture presented about social media, anti-social media, and obsession that the child could come across. You know, we have scaling scaling modulation in our brain system. Scaling modulation, when a circuit, when some synapses are using more than a level, the system turns it off. Because using a synapse, using some neurons, sequentially, it may do harm to the neurons. Scaling is disrupted when cytokines increases. So neurons are impaired, dysfunctional, and do harm to the neurons. So interleukins, or better to say cytokines, can impair plasticity, cerebellum learning. What is cerebellum learning? When you learn how to ride a bicycle, when you learn how to ride a bicycle, after some time, without any thinking, you'd ride it. This riding bicycle is due to cerebellar thinking and memory. It doesn't mean that. You cannot forget it. But cytokines may impair cerebellar learning. In another way, tumor necrosis factor, when it is in a lower concentration, helps memory. But when it increases in its concentration within the brain, it impairs memory. So we should think of cytokines according to context, structure, time, and concentration. They're not always bad. Otherwise, Mother Nature would not have created these molecules. They're messengers. They give crosstalk between the cells. And another cytokine, IL-6, tumor necrosis factor, IL-1, interleukin-1, interleukin-6 are the three most important interleukins or cytokines within our brain. It does the same that TNF does. You know, interleukin-6 can decrease GABA or increase GABA according to the concentration. TNF decreases GABA. But we cannot consider cytokines individually. They should be considered, they should be encountered in a group. Why? They play their role with each other. They do not do any job without each other. Why? Because tumor necrosis factor induces IL-6, IL-1 beta, and even something more. Here, you can see that when something inflammation occurs, higher TNF alpha impairs cognition, lower IQ, higher problems correlated, and visual motor maturity is impaired. In what? In mothers in pregnancy during the second and the third trimester of pregnancy, when the mother gets inflammation and TNF alpha increases, the fetus may have lower IQ. Development of brain in fetus, like Dr. Lipsig, the first one who gave a very interesting lecture about music. You know, the balance between cytokines helps the brain develop or hinder or can be considered as an obstacle to brain development. Okay, when TNF alpha increases within pregnancy, we have also another cytokine called interleukin 8. When interleukin 8 increases, it exactly does contrary to TNF, what TNF does. But within the inflammation, TNF increases, but IL-8 decreases. If the balance between interleukin 8 and TNF alpha is restored, nothing happens. For this reason, we cannot consider just one individual cytokine. Could you recall the slide I told you about pro-inflammatory cytokines, anti-inflammatory cytokines, and cytokines with hematopoiesis effect? We have here pro-inflammatory cytokines. Although the inflammation, when it occurs, it increases pro-inflammatory cytokines, after some time, for the balance to be restored, anti-inflammatory cytokines increases too, for the balance to be restored. Anti-inflammatory cytokines alleviate this deleterious impact of inflammatory process on our memory and plasticity. And this is once again the balance. We have something in ICU called delirium. Delirium means fluctuation of cognitive state, impaired concentration, sleep disturbance, and agitation. One sort of delirium is hypoactive delirium. The patient sleeps, but within his brain or her brain, agitation occurs without any objective sign in the real life. Some cytokines may produce these three symptoms which are cardinal symptoms of delirium. What occurs in delirium? Some cellular inflammatory cells in our brain called microglia are overactivated in elderly patients. And when inflammation occurs and cytokines induces microglia to produce other cytokines, the patient go through delirium, may go through delirium. By what? Another, one theory, delirium is dependent on acetylcholine level in our brain. And another theory is that occurrence of delirium depends on production of cytokines or inflammation. Acetylcholine in itself may inhibit release of pro-inflammatory cytokines. Acetylcholine. And cytokines decrease acetylcholine. When cytokines decrease acetylcholine, the patient goes through delirium. And due to the low concentration of acetylcholine, inflammation goes up. This is a vicious cycle, repetitive cycle. As low acetylcholine, low obstacle against inflammation, cytokines increases and delirium increases too. And delirium may end or result in dementia. Dementia. So cytokines contributes to dementia. Many of our patients in sepsis, the most dysregulated inflammatory process in our body, may not go to the real life, or may not have quality of life after they discharge, because these cytokines are so dysregulated within their brain that delirium increases, delirium results in PTSD, delirium results in dementia, and the patient, although has been discharged from ICU, cannot cope with the normal life. So cytokines can be neuroprotective or destructive, may inhibit or stimulate the release of other cytokines. Their effect depends on particular tissue situation time, and their effect is very complex. It cannot be considered in just one individual cytokine to do this and to do that, and another one this and that. This is a complex system. And I showed this slide, and at the last Congress we had, here is the Earth. Here is the Saturn, and this is a real photography by Cassini, and you can see that in the vast, mighty area of universe we live on this spot. So live in peace, without cytokines. If there's any question. This is my ICU in Tehran, and this is a patient who needed a tracheostomy, and we did it bedside. Tracheostomy is a procedure to open the trachea and put the very small tube within the trachea. And this is Millat Park in Tehran. Yes.
How do you assess the cytokines? And is there any medical exam for it?
Yes, you know, we have two sorts of assessing cytokines. One, examine or measure the concentration of the cytokine. It is a very time-consuming phenomena and task. And another thing that you can have some surrogate model. For example, when the cytokines increases in the brain, a protein called S100 beta is released from astrocytes or microglia, the cells that produce cytokines. It goes to the blood and can be measured easily.